Welcome to the special event Auxiliary Medical Directive Review on minor abrasions, minor allergic reaction, musculoskeletal pain, headache. I'm Christine Hardy, Regional Paramedic Educator, and joining me today is Dwayne Cattell.
So what we're going to be doing today, guys, is talking about the special events medical directives, and these are the directives that the service has had approval to use, and it's for like mass gatherings of people. It's not like your everyday working in the trucks type of medical directive. So what are our objectives today? So we're going to, once you're done the whole program, we're going to be able to define what a special event is. We're going to look at the medical directives that are specifically associated with special events, and then we're going to go over a few different cases and some examples of how to apply this in a variety of different situations and settings.
A special event is defined as a pre-planned gathering with potentially large numbers of people, usually occurring within your community. These medical directives must have been pre-authorized by use by the local medical director, and it's usually an association with the EMS Service.
So we're talking about special events, and it's a mass gathering of people. Different things like Run for the Cure, like where you have like a few thousand runners, like marathons, that sort of thing. Open concerts like Bayfest, Sunfest, and just like large mass gatherings of people. And it can vary, and your service will make that decision in conjunction with the regional and local medical director of your service.
So we'll begin with the minor abrasions medical directive. Let's assume you're working at a kids' fun day festival with the proceeds going to the hospital for sick children. So that, again, this is an agreement between the local medical director and the service that you are on scene providing care. You're approached by a father carrying his young son who's fallen and scraped his knee. You can see the extent of the injury of the child's knee in the picture. So here's a copy of the minor abrasions medical directive. You can apply a topical antibiotic to this child's scrape under the condition that he has an unaltered level of awareness. He does not have any allergies to any of the components contained within the topical antibiotic. So you would apply the treatment and you would consider releasing this child from your care. Also, it's important to tell the parent or the patient that if the problem persists or gets worse, that they're to seek further medical attention.
So looking at some of the examples of the medication, the topical antibiotic that you would carry, polysporin, neosporin, topical antibiotics, for minor abrasions and scrapes. They can contain polymyxin or neomycin or bactrectin, and it's used just basically to prevent infection and to speed up healing of the soft tissue injury, the minor soft tissue injury.
Usually this is a package the service puts together and provides you with when you go to the special event.
So they need to go to the emerge. That's bad. Don't take polysporin, rub it on, and say, okay, go home. Major and use your best clinical decision-making skills and use sound judgment. Something like that is, they need a physician right away.
So moving on to the allergic reaction directive, let's assume that a 23-year-old male patient approaches you and says that he has hives and itchiness after applying sunscreen. So you could treat this patient with Benadryl or diphenhydramine. And the conditions for the administration of it, the patient has to be greater than or equal to 18 years old and have no decreased level of awareness. There are contraindications for the use of diphenhydramine, and they include an allergy or sensitivity to the medication, antihistamine or sedative use in the past 4 hours, signs and symptoms of a moderate to severe allergic reaction, signs and symptoms of intoxication, or any wheezing. So the treatment would be administering the patient Benadryl by mouth. It would be 50 milligram dose, and you would only give that once. After you've administered and the patient has taken the Benadryl, then you would consider release from care, again advising the patient if the problem persists or gets worse, they're to get further medical direction.
So when we look at signs and symptoms associated with like a minor allergic reaction or a moderate to severe allergic reaction or anaphylaxis, minor allergic reaction, hives, nausea, like the itchy skin, the warm sensation, localized swelling, that's minor. That would qualify in a special event situation for like solely Benadryl PO by mouth. When you start getting into more severe allergic reaction, when there's airway compromise, there's vomiting, diarrhea, there's wheezing present, they're hypotensive, basically becoming an anaphylactic reaction, then care is now going to your directives, were not your special events directives, but your life-saving directives of epinephrine, intramuscular, and Benadryl, and be considering that these people need to get to an emergency department quickly.
So if you were presented with this child at a special event, you notice the severe swelling around the eyes, and you can't see it, but particularly around the neck, this is when you would consider your moderate to severe allergic reaction medical directive. And as a recall, epinephrine is always the first drug of choice in the setting of anaphylaxis. So you would proceed with that directive, call an ambulance for this patient to be treated. You would treat him on the scene, and then he would be transported to the hospital via a different ambulance.
So moving on, the musculoskeletal pain medical directive, and once again this is for special events, mass gathering of people. So when we look at this directive or indications, the patient has to have minor musculoskeletal pain, they can't have an unaltered level of awareness, they have to be a minimum of 18 years of age, and some of the contraindications for the acetaminophen administration are an allergy to acetaminophen, of course, as any acetaminophen ingestion within the last 4 hours, and if they appear intoxicated to you, then absolutely no acetaminophen will be administered. The dosing, it's 1 dose maximum, it's orally, PO, and it's between 325 and 650 milligrams, and the maximum single dose is 650 milligrams PO. And once again, this is for the special events medical directives only. So acetaminophen, what is acetaminophen? Its actions, pharmacokinetics and dynamics. It's an analgesic. It does have antipyretic properties. It's thought to reduce the production of prostaglandins in the brain, and therefore elevates the pain threshold and will block those nociceptors from receiving any painful stimuli response.
So in this situation, this is a patient who could approach you and say they have aching muscle joints, maybe in the hands or wrists after multiple finger puppet shows. If this patient has an unaltered GCS, no contraindications to Tylenol, and is greater than 18 years old, then he can receive 650 milligrams maximum of Tylenol acetaminophen by mouth.
So looking at this amputated finger, yeah, probably not a good idea to give Tylenol no service. They need a surgeon. Get this patient to the emerge, do your BLS care, bleeding control, neurovascular assessment, and rapid transport packaging of the amputated limb. I think it's self-explanatory.
So the final medical directive contained in this series is the headache medical directive, and this is when a patient is complaining of a headache that is uncomplicated and somewhat normal for the patient. Again, the conditions for Tylenol or acetaminophen administration include the patient must be 18 years of age or older, have an unaltered level of awareness. The contraindications are the same as they were the previous slide. No sensitivity or allergy to acetaminophen, no alcohol intoxication, and they have not ingested acetaminophen in the past 4 hours. This patient would receive a maximum of 650 milligrams of Tylenol or acetaminophen by mouth once. Consider releasing this patient from your care, and again, it's important to remember to tell the patient if this problem persists or worse to seek further medical attention.
So always remember, looking for different underlying disorders, do your BLS care. You know, you should be thinking if there's some type of seriously underlying disorder, like it's a recent onset, there's been a change in pattern of the headache, you know, it's sudden. You know, basically, if you think there's like head trauma, or if it's an abnormal headache, you know, you're thinking maybe hemorrhagic stroke or some type of bleed going on, absolutely, you know what, these people need to go to the hospital. Don't give the acetaminophen. If in your judgment this person needs to get to a physician right away, and get them in the ambulance and get moving to the emerge.
So your documentation requirements are the same as every other day at work. You would complete an ACR or EACR as your service requires, contact CAC for a run number, and any additional paperwork to be filled out will be dictated to you by your service.
So always remember, the question always comes up, well, if we're at a special event and we're in our ambulance and we're here for the day, and the patient comes up to us and it's they're presenting worse, or they don't quite meet the directive because they're more severe, can we treat them with our regular medical directives? Absolutely. Absolutely treat them. If they're anaphylactic, if there's like a head injury going on, if the headache's out of the norm, you know, do your BLS care, and then your other medications if necessary, and then they need to be transported to the emerge to get assessed by a physician.
And one of the most common occurrences is a patient who presents to an ambulance complaining of chest pain or shortness of breath. In that case, you would do your regular assessment and apply your regular medical directives.
So if you have any questions regarding the special events directives or any other medical directives, feel free to contact any one of the regional paramedic educators listed below. You can contact us by email. Our phone numbers are actually in your directives pocket guide. And yeah, if you have any questions, don't be hesitant on calling us or getting in contact with us. Thank you.